Viewers, welcome to the Learners Nursing classes. This is mock test 4 and we will do multiple choice questions for the exam. So without delaying, let us start. At which of the following weeks of gestation does the uterus normally reaches to the level of the xiphisternum? See, here the answer is 36 weeks. Which among the following hormone is secreted by pituitary gland? See, calcitonin, glucocorticosteroids, glucagon or prolactin. So we have studied that pituitary gland secretes prolactin and it वो newborn baby के mother को वो reflex आता है तो milk production होता है तो we should the answer is prolactin. Iron supplementation in a healthy term breastfed baby should be started at the age of 2 weeks, 4 weeks, 6 weeks, 8 weeks. Here the answer is 6 weeks. Surfactant inactivation occurs in, देखो surfactant inactivation मतलब surfactant काम नहीं कर रहा है, कब होगा? Infant of diabetic mother, meconium aspiration syndrome, transient tachypnea of newborn, bronchopulmonary dysplasia. See, when the trachea is full of meconium and the lungs are full of meconium fluid, that time the surfactant inactivation may occur. So here the answer is meconium aspiration syndrome. Macrosomia means baby with a large tongue, baby with a large head, large size baby, baby whose birth weight is not adequate to the length. See, large size babies are called macrosomia. Forceps should not be used in, जो forceps delivery होती हैं, जो obstetric forceps होते हैं, उनको कहाँ यूज़ नहीं करना चाहिए? सी ट्विन डिलीवरी में यूज़ नहीं करना चाहिए, या हाइड्रोकेफेलस में, या पोस्ट मेच्योरिटी में, या आफ्टर कमिंग हेड ऑफ द ब्रीच. सी, हाइड्रोकेफेलस अगर एंटीनेटली डायग्नोस्ड है तो नेवर यूज़ फोर्सेप्स इन हाइड्रोकेफेलस. At what stage of labor episiotomy is usually done? See, whenever patient is in labor and at the time of crowning, just before the delivery of the head, at the time of crowning we give episiotomy, so that is second stage. So these options are not there. An irregular acyclic bleeding from the uterus is known as, see, options are polymenorrhea, metrorrhagia, oligomenorrhea, menorrhagia. So here the answer is metrorrhagia. Select the correct statement regarding the specific disorder of musculoskeletal system. See, osteoporosis, decrease in bone mass and higher chances of fracture with advancing age. Myasthenia gravis, an autoimmune disorder characterized by inflammation of the joints. Gout, inflammation of joint due to extra deposition of calcium. Age-related shortening of muscle. See, select the correct statement regarding the specific disorder of musculoskeletal system. See, इसमें ना osteoporosis, decrease in the bone mass and higher chances of fracture with advancing age is the right answer. Myasthenia gravis is an autoimmune disorder but not the inflammation of joint, and gout, inflammation of joint due to not deposition of calcium, and age related muscle shortening is not the right answer. Which hormone is necessary for the positive pregnancy test? प्रोजेस्ट्रॉन, एचसीजी, एस्ट्रोजन, प्लेसेंटल लैक्टोजन. सी, इसमें क्या होता है? ह्यूमन कोरियोनिक गोनाडोट्रोपिन हार्मोन. हम एचसीजी का टेस्ट भी करते हैं, यूरिन में भी एचसीजी का टेस्ट करते हैं कि यूरिन फॉर ग्रेविडेक्स जो होता है वो ये एचसीजी उसमें प्रेजेंट है वो टेस्ट करता है. तो हेयर द आंसर इज एचसीजी. All the following are normal manifestation in a newborn baby except uneven head shape. Respirations are irregular, abdominal 30 to 60 beat per minute, positive Morose reflex, heart rate is 80 beat per minute. इसमें कह रहे हैं कि कौन सा वाला न्यूबॉर्न बेबी का साइन नहीं है. सी, अनइवन हेड होता है बेबी में रेस्पिरेशंस और रेगुलर एब्डोमिनल होती हैं, इरेगुलर भी होती हैं. 30 to 60 बीट पर रेस्पिरेटरी रेट 30 to 60 ब्रेथ्स पर मिनट भी होता है. पॉजिटिव मोरोज रिफ्लेक्स भी होता है. व्हाट इज मोरोज रिफ्लेक्स? द मोमेंट यू होल्ड द बेबी इन योर आर्म एंड रिमूव द बेडशीट, द बेबी सडनली विल हैव अ जर्क एंड द आर्म्स विल ओपन एंड द abduction followed by a cry. So what is the नहीं होता है, that the correct option is heart rate is 80 beat per minute. is ये नहीं होता. Euphoria is caused by which of the following? See, what is euphoria? Euphoria is a मतलब very high stage of happiness. So इसमें क्या लिखा है? सेडेटिव ड्रग्स, साइकोट्रोपिक ड्रग्स, फ्यूमिगेंट सब्सटेंसेस, both option A and B. See here answer is psychotropic drugs. Estimated date of delivery is calculated by using the Neagley's rule, and I want to tell you Neagley's rule is only applicable for the cycle of 29 to 30 days, and then you will get an appropriate EDD. Keep a medicine in the internal cavity of the body in liquid form is called as. Inhalation तो steam लेते हैं, और insertion when we put, insufflation is when you put the gas inside, तो the answer is instillation. The volume of urine in oliguria is less than 100 ml, less than 400 ml, less than 800 ml, does not make urine. See, answer is less than 400 ml. Nosocomial infections are also known as, see very easy answer, iatrogenic नहीं होता है, प्राइमरी नहीं होता है, इडियोपैथिक नहीं होता है. आंसर होता है हॉस्पिटल एक्वायर्ड इन्फेक्शन. Change in the amount of which of the following electrolyte causes tetany? See, tetany is always related to calcium. So whenever there is hypocalcemia, hypermagnesemia, hypercalcemia or hyponatremia, answer is hypocalcemia, उसी में टिटनी होती है. Which position is mostly recommended for the rectal examination? See, rectal examination के लिए the best position is, lithotomy नहीं होती है, dorsal recumbent position नहीं होती है, prone position नहीं होती है, the best is Sims position. Which preparation is given in the depth of the muscle by Z technique? See, Z technique is classically used for iron. सो ये रिमेंबर करना पड़ेगा, क्योंकि जिंक और वाइटामिन सी एंड कैल्शियम के लिए नहीं, ओनली फॉर आयरन. विच ऑफ द फॉलोइंग इज द करेक्ट क्राइटेरिया फॉर लो बर्थ वेट? सी, बेबी वेइंग लेस देन 1.5 kg एट बर्थ, ओवरऑल बेबी वेट एट बर्थ लेस देन 2.5 kg, बेबी वेइंग लेस देन 4 kg एट बर्थ, एंड बेबी लेइंग. तो देखिए, अगर आप इसमें देखो तो ये दोनों ऑप्शन अपने आप कैंसिल हो जाती हैं. So what can be the right answer? This is the overall baby weight is less than 2.5 kg. Common risk factor in patient with severe depression is, what are the risk factor? मतलब उसमें क्या डर है? Fatigability, hallucination, agitation, suicidal tendency. See, whenever there is depression, there is always chances of suicidal tendency. Which of the following disease not caused by viruses? See, polio is caused by virus, chickenpox is caused by virus, AIDS is also caused by virus. So answer is tuberculosis. Component of under 5 clinic includes vaccination, nutrition survey, ORS therapy. Answer is all of these. Malaria is caused by Plasmodium falciparum, entamoeba, retrovirus, salmonella. See, answer is Plasmodium falciparum. The main cause of lung cancer is, see, alcohol नहीं है, exposure to sunlight नहीं है, all above नहीं है. Here this answer is very simple. Cause of lung cancer is smoking. Pulse polio immunization covers 0 to 5 children, 0 to 1 year children, 1 to 5 year children, 0 to 2 years. See, covers 0 to 5 years of children. Fat is stored in adipose tissue, not blood, not liver, not muscle. Orange is a major source of, see, citrus fruit है तो vitamin C का ही source होगा. The smallest structural unit of protein is not protease, not peptides, not peptones. It is amino acid. Which of the following is not a vitamin? Folic acid, lactic acid, nicotinic acid और ascorbic acid. So इसमें कौन सा नहीं है? Answer is lactic acid. Select the false statement regarding fat. They are heat regulators. They provide less energy than carbohydrates. They are unsaturated compounds of carbon, hydrogen, and oxygen. Together with protein, they form cell membrane. See here, the false statement select करनी है. So they provide less energy than carbohydrate. Rather, they provide quite a lot of energy than carbohydrates. Sex education may be introduced at a primary stage through a separate subject. No. Knowledge about hygiene. Integration. No. Integration with physical education. Yes. And lesson on nature study is also no. So integration with the physical education. Qualitative and quantitative research are the classifications of research on the basis of the use of research, time, dimension, technique used, purpose of the research. See, technique used. The following are the principles of health education except. See, following are the principles of health education except कौन सा नहीं है. So there are principles like comprehension, credibility, reinforcement and known to unknown. So the answer is कौन सा नहीं है, unknown to known. What is the main purpose of ABC analysis in material management? See, what is it is to control purchasing, to control inventories, to control obsolescence, to control to determine stocking. Here the answer is to control inventory. So what is the full form of ABC? Always better control. This is actually for the inventory. Which of the following gases is used sterilization for the medical equipment? Methylene oxide, ethylene oxide, methane gas, ethane gas. See, the correct answer is ethylene oxide. In which of the type of schizophrenia the patient's motor behavior is greatly disturbed? Catatonic schizophrenia, residual schizophrenia, hebephrenic schizophrenia and paranoid schizophrenia. See, catatonic schizophrenia में क्या होता है, पेशेंट की चाल ढाल भी बिगड़ जाती है, उसका गेट ही बिगड़ जाता है. तो the answer is catatonic schizophrenia. Mental illness that causes bodily symptoms including pain and the symptoms can't be traced back to the physical causes is known as somatoform disorder. Answer is somatoform disorder. Thank you so much, viewers. Like, subscribe and share. With this, we complete the mock test 4. We'll come shortly with more valuable videos for you in future.